Hi, my name is Angus and this is my practical simulation practice session. I've organised a session before my client has arrived. I have considered other gym users and members. I've gained the permission from my mentor and the business owner. I've checked all the equipment in the area for OH&S risks or potential hazards. I'm ready and organised. I'm waiting for my client, who I contacted last night, to confirm time, date and venue.
Crystal?
How are you going?
Good to meet you.
How are you feeling today?
Great.
That's good. Well, today we're going to do some tests. We're going to do a endurance push-up test to start with. Do you have any injuries that could prevent you from training today?
No, I don't think so.
Yeah, that's good. I've gone over your PQA and I'm happy with all your answers. I noticed that you've had a stress fracture in your right foot not long ago, so we'll be mindful of that. We won't do anything like too much running or anything that's going to cause too much stress on that. I've noticed that you have osteoporosis and arthritis, so we'll just be mindful of all those things. And your lower back pain, we'll just be very careful.
That's from the arthritis.
Yep. Yep. So hopefully we'll be able to strengthen your back and things with your exercise program. All right, I don't have any more questions. Do you have any more questions or concerns before we start?
No, I'm fine.
Yep. And just so you know that everything that you've written in here and everything that you say is confidential. Okay? Excellent. All right, Sandra, this is going to be the push-up test. It's a strength and endurance test. It measures your upper body strength and endurance. So during push-up, you'll work your biceps, your triceps, your forearm muscles, your deltoids and your pectoral major muscles. Your core will be quite active during the motion. Right, so I'll just give you a demonstration on how we're going to do this. So down on your knees, bring your arms forward, about shoulder width apart, up on your toes if you can, and come down, and then come back up. If you can't do the push-up on your toes, get down on your knees, come down, and come back up, nearly touching the ground. So remember to breathe in on the way down, and exhale on the way up. So push yourself, blow yourself away from the ground. Okay? So
How many do you want me to do?
well, for this test, it's as many as you can do. So I've got a little chart here. That. All right. So 1, 2, 3, 4, 5, 6, 7. Keeping your head up a little bit more. Yep. 8, 9, 10, 11, 12, 13, 14. Good job. 15, 16, 17, 18, 19, 20, 21, 22, 23. Good job. 26, 27, push to 30, 28, 29, oh, come on, 30. Oh, good, yep, that's great, Sandra. Well, 30 push-ups for someone in your age group is excellent. That is awesome. Sandra did just do a class before this endurance test, so she is warm, and you would have already done some push-ups in the class.
Yeah.
So 30 push-ups is fantastic, Sandra. That is amazing. So we would only work on that, and you could build on that. So you're right at the top of the scale. So well done. Sandra, we're going to be doing a dumbbell chest press. Got the 5 kilo dumbbells. They should be right. I'll just lay down, and I'll give you a demonstration on how we're going to do that. Alright, so feet flat on the floor. Hold your dumbbells close to your chest, and come down. Alright. Lift your dumbbells up, palms facing up, above your shoulders. bring your dumbbells down until your elbows are in line with your chest. Exhale as you come up, and inhale as you come down. Keeping your core nice and strong as you do this exercise. And when you finish, bring your dumbbells in, bring them close to your chest, and sit up and bring them down. Okay? Good. So you get that on there. Remember to roll your shoulder blades back. Now we won't come down that far. We'll just come, yep, just to there. That's fine. Breathing in and breathing out. 3, 4, 5, 6, 7, 8, 9, and 10. Now bring them towards, yep, and sit up. Okay, so in that exercise, you're working your pectoralis majors, your pectoralis minus, your anterior delts, your triceps, and your anteriors.
I won't ask you where that is.
Alright, so the joints being used in that exercise were your shoulder joint, and that was a shoulder horizontal adduction. So that was when you're up, that was as you were coming down, and an elbow flexion, and your scapulothoric joint, and that was an adduction, and that was as you went up. So adduction as you go up, and adduction as you come down, and abduction as you go up. And that's the bench press. Alright, Sandra, we're going to do the bend over row now. For this exercise, we're just going to use the barbell. We're not going to put any weights on it because we're just going to get technique, okay? So first of all, we're going to hold barbell straight out in front of us. Palms facing down, okay? Legs shoulder width apart. Okay, so loosen up, get ready. Alright, so we bend at the knees just a little bit, okay? And we hinge at our hips, okay? So and that's to come forward. Alright, keeping your head up, your head needs to be in the same plane as your spine. So no head down, no looking in the mirror, like your head needs to be
In the same line.
Yep, in the same line. Yep. Keeping your torso strong and still. Breathe in as you lift up. Retracting your scapula and then pulling your elbows in. And then breathe out as you come down. And remember, this is a row, it's not a lift. You're not just lifting it. You're bringing it towards your chest. Alright, so doing this as a narrow grip, you're working more your lats. If you wanted to work your posterior delts, you have a wider grip, same thing. Hinging at hips and bending at the knees a bit. Poking your bottom out a bit. And same thing, you just bring it towards yourself, bring it towards your body. Remember to retract your scapula, then pulling in your elbows, okay? Trying to get those shoulder blades to touch, okay? So you have a go at that if you like. Yep. It's really good. Yep, so that's, so now you're working your posterior delts at the moment. So this particular exercise is really good for working your biceps, your latissimus dorsi, your teres minor and major, your rhomboids and your brachialis. So with this you've got the shoulder horizontal extension, your scapular retraction and your arm flexion. Yep. So with this particular exercise you would start with just the bar and then you'd move on to a weight.
Technique right.
You get your technique right, then move on to a weight. And if you're in doubt, you just start with a lighter weight. Try it and see how you're going. If you're happy, move on and keep going. Get stronger and stronger. Okay? So That's it. Sandra, for this exercise, we're doing a barbell squat. Similar just to a normal squat, but we're just going to have a barbell on our shoulders. Okay, so with a barbell squat, we're just going to use the barbell without the weight, just to work on technique to start with. Okay, so you bring your barbell behind you. Being careful not to weight this way. We don't want it sitting up here. We want to roll it down a bit and sit it just on our shoulders. Okay? So that's a lot more comfortable having it there than anywhere else. Okay, so bring it down. Okay, so for our squat, legs shoulder width apart. Okay. We squat down till our knees are parallel with the ground. Right, so, and with this exercise, remember to lead with your hips. Okay, you're not going down with your knees. Right, you shouldn't feel any pressure in your knees. You're leading with your hips. Okay.
Bum's going out first.
Bum's going out first. That's right. Right, you shouldn't feel any pressure in your knees. And take the weight through your heels. Okay, so go right down. Okay, and in this exercise, you're working your quadriceps, gluteus maximus. They're the main muscles you're working. So we'll get you to have a go of that. Right. That looks pretty good. Remember keeping your head up too. Sorry, I should have said that. So keeping your head up. Yep. Come down. Yep. Yep. But being careful not to bring your knees. So bring your legs out a bit further. You don't want to bring your knees over your toes. Okay, so yep.
So they go more into
so they toes come around a bit more. Yep. Yeah, and we just want to feel that squat. Yep. Yep. And this is a good compound exercise. You're working a lot of different muscles at once. Working your obliques, working your rectus abdominal muscles. So you've got hip flexion and knee flexion, and your ankles, which is called a dorsiflexion, because you're moving your ankles, but you probably don't realise that.
I did.
Yeah.
I did when I had the boot from the stress fracture.
Yep.
Yeah.
Yep. Oh, that's interesting, because I've not really noticed that with your ankle, and you think, oh, you do too.
Yeah. Oh, it's amazing how often you do use it.
Mm.
Yeah.
So that feel good?
Yeah, that feels good.
Oh, wonderful. All right, so just like I said before with the bar before, with the front row, if you're with the weight, just try it with no weight, then gradually add weights on, okay? Because you don't want to injure yourself.
No.
And also, make sure you don't come too far down in your squat, because you don't want to injure your lower back.
You won't be able to get up.
Yep. Yeah, well, that's right. All right, Sandra, we're going to do a wall push-up for a client with high blood pressure. All right? I wouldn't recommend a client with high blood pressure to get down on the ground and do a push-up. Too much pressure on their heart, and we recommend that they stay elevated. Okay? So for a wall push-up, hands shoulder width apart, come back away from the wall. Don't lock your knees in. Bring it down a bit, yep, about there, to your chest. Keeping your head in neutral position. Come down forward. And do the push-up. Come down and do the push-up. Okay?
Want me to try that one?
Yes, please. So exhale as you come away from the wall. Yep, that's great.
You often see people when we start doing push-ups that way.
Yeah. It's a lot easier, but
Yeah.
and if you want to increase the intensity of it, you just come out further
Yeah.
and just makes it just a little bit harder.
Yeah.
All right, so we're going to do a sit-up for a client with lower back pain, but I wouldn't recommend a sit-up for someone with lower back pain. You've got lower back pain, so this is what I'd recommend for you to do. It's called a bird dog exercise. So get down on your all fours, knees hip width apart.
Yep.
Okay. So first of all, I'd just try and lift one arm up to see how that feels. And if that feels fine, I lift the other leg up. The opposite. Just see how that feels. And if that feels fine, try both, lifting up nice and slowly. Right, we don't want to lift your leg up like that because that'll hurt your lower back. We don't want to lift, we're not lifting our head up or anything. We've got our head in neutral position with our spine. We just lift up nice and slowly, and we hold that for 7 to 10 seconds. And then come back down slowly. And then same on the other side. Okay? So I'll just get you to get down and just try that.
Just try that.
How's that feel?
Yeah, it's fine. Yeah, try the leg.
Yeah. Yeah, so I wouldn't lift it up too high, just out.
Right?
Yeah, that's great. And actually really engage your core.
Balance.
Yeah. Well, this is also really good for balance.
Yeah.
It's a really good one for balance. Yeah, that's great. And so we'll just bring that in nice and slowly, and I'd recommend it's one of those, each one is 1 repetition.
Yeah.
So I'd say do between 10 to 12 repetitions, okay? And nice and slowly. And like I said, this is good for balance, but this will help improve lower back pain as well.
Keeps you moving.
Yeah, keeps you moving, good strength. Sandra, cardio endurance. We're going to get on the cross trainer. The cross trainer is quite a good alternative to the treadmill. It mimics the same motion as a treadmill would. It's just got little to no impact on your joints. So this is a really good one for, say, your ankle injury. Yep. So to get on here, we just hold on, get our feet on the platforms. All right. And we come around here. Just quick start. All right. Now we've got a little thing here to enter. You push enter. If you want to select your program, okay? So, but for a start, we're just going to go quick start, and we're just going. So we go back and forth, back and forth. Now, ideally, keep your feet flat on the platform. For a bit of a more of a workout in the calves, you can lift up just to kick off the back and to increase the intensity. Have it on low resistance, right? So that means you can go faster. And if you want to go a bit harder for strength, turn it right up. So if you want to go strength training, push maximum. Yep, it's a lot harder, okay? So you get on, I'll just reset for you. You get on there, have a go. And just, yep. And you get on there for about just doing warm up, you do 5 to 10 minutes. But if you wanted to have a good cardio session, you get on there for about 20. And like I said, intensity can be altered by changing that around with however you're feeling at the time or what you want to do. Just change the resistance on that, okay? The muscles you're working on here are similar to running. You're working your hamstrings, your quadriceps, glutes, muscles, your biceps, your chest, your biceps, your back, you're working a lot of muscles. Well, it's an all-over exercise. It's good. So we'll leave you on there for a little bit. Right, Sandra. Another cardio endurance. We're on the rowing machine. Alright, so I'll just get on and I'll give you a demonstration. Rowing is quite low impact on your body, but at the same time it's got high intensity. It's a great cardiovascular exercise with, like I said, low intensity. Alright, so for this, put your feet in there. You see here, it's too low. Okay? Your feet, the strap needs to go over the ball of your feet. Okay, so bring that up, bring it down. I'm on about number 3. What size shoe are you in? 8. Yeah, well you'd be on 3 too, I reckon. That's on the cross, so it's not on my toes there, it's across the balls. Okay? Nice and tight. Pull those nice and tight, get nice and comfortable. So we'll grab the push menu. So come over here and have a look. So for this we're just going to do just row, okay? Just row. Hold on, palms facing out. So with the rower, legs first, core, then arms. And then arms, core, and then legs. Okay? Legs, core, arms, core, legs. Okay, so 60% in your legs, 20% in core, and 20% in your arms. Okay? Then you just come back the other way. So it goes 1, 2, 3. 1, 2, 3. Okay? Sorry. The 2, 3 is recovery. Okay? So just 1, 2, 3, 1, 2, 3, and in your mind, legs, core, arms, legs, core, arms. Or legs, core, arms, arms, core, legs. Okay? Oh, I like it on 10. What would you like to know? Yeah. Right, so we'll get your feet in there. Is that comfortable for you? So lots of people think that with a roller it's just pulling, but it's not. It's actually lower.
This was quite hard to do with boot because I couldn't flex here.
Yep.
It was all stiff, so it just didn't work.
Wonderful. Yep, so we'll go legs, core, arms. Okay, so pull on your legs, legs, core, arms. Yep. Then arms, core, arms. Yep. That's great. Alright, so to increase the intensity on the rower, is the harder you push, and the harder you push off and pull, that will increase the intensity. Yep, so the farther you get faster and faster as you go, and that will increase your intensity. And as your intensity goes up, you'll pump your blood around your body, which will increase your stroke volume to your heart, and that's beats per minute. And the output increases the blood travelling around your body, delivering oxygen to all the working muscles in your body. So the energy system that's being used at the moment are the lactic and the phosphocreatine, because you're moderate to high intensity, then high intensity. So you're high intensity, then 2, 3. High intensity, then you're 2, 3. High intensity, 2, 3. Yep. 60%, 20%, 60%. Legs, That's great. You're doing really good.
good workout, isn't it?
Yeah, it's really good. It's really good for your heart. It's fun to get all the oxygen around. That's really good. Well done. Right, Sandra. Alright, so for my innovative cardio, we're going to do a boxing pyramid, Sandra. Now, you did mention that you've had the stress fracture on your foot. So we'll just see how you go with this, and if at any time you feel sore or it hurts, we'll just stop or tone it down and we'll just walk. Okay?
I'll let you know.
Yeah, good. Alright, so for starters, this is how we'll do it. You'll go 2 jabs. Okay, so stand in front of me, 1 foot in front of the other. Yep, nice and, yep. So 2 jabs, 1, so 1, 2. Yep, crossover jab, sorry. So 1, 2, and then you'll turn around and you'll run up here, run to the end, and we'll just don't run to the end. We'll just run to the end. And we'll just do a squat. I'm going to stay up there.
Oh, yes.
So we're just going to do a squat,
Yep.
and then you're going to come back, do 4 crossover jabs, run back up there, do 2 squats,
Yes.
come back, and we're just going to go up to 20, and then back down to
Pressing 1, 2,
2, 1.
1.
Yep, yep. Right, so come back down here. So this is all about energy systems, the metabolic systems. This is a high intensity, which is the boxing.
Yes.
That uses the phosphocreatine in your body, which is the APT CT system. The fuel source from this is the creatine phosphate. Recovery time when you're using this system is between 30 seconds and 2 minutes. Your recovery time from this particular high intensity is when you're there doing the squat.
Get the breath back.
Yeah, that's when you get your breath back after the. Yeah. Right. So and the moderate to high intensity, the running and the squatting. So that's only moderate to high intensity. Like it can be as high as you want it to be and as low as you want it to be. And that is the metabolic system you're using then is the lactic acid, and the fuel source that comes from is the glycosamine and the glycogen and the glucose. And the required time for recovery when using this particular system is 20 minutes to 2 hours. So we'll just have a go at this and see how you go.
And then I'll run up here. And 1 squat. And then back.
And so forth. That's good. And that's what you do for that particular innovative cardio. Right, Sandra, we're going to do a quadricep stretch and a pectoralis stretch. Okay. So for the quadricep stretch, we're just going to, depending on how balanced you are, you can hold on to a wall if you need to, and just lift up a leg behind you. Or if you've got balance, you just hold on to your tummy, lift up, and hold that stretch. I like to hold it with the same arm as the same leg, and hold behind my toes, just so I can feel that stretch and pull it up further to feel the stretch even more if I need to. Or I can come down if it's hurting a bit, or I can come up, pull that stretch even further. Yep. So I'd say 30 seconds. Come down slowly, and then I'd come on to the other one, and I'd hold that for 30 seconds. Well, I find it helps me. Different people have different techniques, but I find that helps with balance. And then come down, and then you just swap over, and I'd recommend doing 3 on each side. Okay? Right, so for a pectoralis stretch, we're going to put our legs shoulder width apart. Grab our hands, put them behind behind our backs, like this, and we're just going to pull back, okay? So we're just going to push out, so keeping our head up, and we're just going to and then we'll just release, come in, and we'll just bring our shoulders forward, come back again. Hold that stretch, I'd say, for about 30 seconds. Breathing in now as you do it. And just release that stretch. And I'd recommend
It's quite a long time when you just...
it is, but stretching is a very important part of exercise. Good. And how'd that feel?
Yeah, that feels good.
Yep, your pecs and in your quadriceps. Feel nice? Yep. That's good.
Distance it all up again.
And that's good.